self-hypnosis for many years. And in my practice, I realized that I can use the hypnosis as an adjunct to my nutrition counseling. And it works wonderfully together. My aspect of the nutrition is more clinical nutrition. And I work through that because I empower the patients to be able to really understand what it is they need to do. We are all here this morning because we're interested in the children. So many children are getting bigger and bigger. Americans are getting bigger and bigger. We need to get a grip on this. We need to be able to slow it down. Still have the goodies, but what we have to do is limit them. Basically, we have simple causes for obesity now. The portions are too large. Some of the fast food companies are stopping supersizing. Poor food choices. Parents are in control of what the children have access to. When a child is under 7 years old, you're basically in control of what they have, especially what's at home. And what's happening right now is parents are not home. Someone else, there's caregivers. What we need to do is make sure that there's appropriate foods available for the children. We don't want the children to go hungry. Snacking is fine. Snacking is very important, in fact, so that when you go to a meal, you're not starving. The junk food, too much is available. And I tell the parents, junk food is just that, junk. Think of junk as garbage. Do you want your child putting garbage in their bodies? We wouldn't think of it. If parents are trying to lose weight themselves, they say, I need to have the junk food in the house for the kids. It's really not necessary. Inactivity. The children do not go out to play like we might have when we were young. They don't have the outlets. And we have to get the schools, we have to get the parents to help the children have those activities. And along with the children, the parents can be doing things too. Genetics plays a role. But we're not going to get into the genetics part right now. We're learning more and more about the genetics. Certain medications, certain asthma medications, and prednisone cause an increased appetite for some people and also weight gain. Dehydration, many people don't know that once you become dehydrated and it's just before you feel thirsty, your metabolism slows down. So this is for everyone, for children and for adults. There's so much that we need to know. There's so much that we can empower people with little tidbits of information that's helpful, along with the therapeutic hypnosis. Excess television watching. Once a child is watching television for 3 hours, it has been shown, scientifically measured, metabolism slows down.